Welcome back to my channel, and I hope all of you guys are doing well and staying healthy. Today I wanted to talk a little bit about the difference between internal medicine and general surgery. So let's get started. So in medicine, specialties can be separated into two broad categories: surgical or non-surgical. The two broad categories that most people refer to are known as internal medicine and general surgery. Now this is a gross generalization because there are many specialties that are considered medicine, and there are also many subspecialties in the category of surgery. But for the purpose of today's topic, I kind of just wanted to broadly introduce you guys to the general two categories: internal medicine, which is known as the non-surgical field, and general surgery, which is known as the surgical field. We can learn about what makes each group unique, and hopefully this will help you decide what field is best for you. I'm going to break down the differences and similarities into three categories. One is what the resident's day-to-day looks like. Two, what specific skills are emphasized in each specialty. And three, what further subspecialties you can go into. So hopefully this will give you a general idea of what each specialty entails. So now with regards to what the day-to-day looks like for a resident in internal medicine, at 6:30 a.m. is when you usually get to the hospital, and you'll review the list of patients you are responsible for, and it's a transfer of workload from the night team to the day team. After sign out, you will go see your patients individually, and at 8 o'clock we will have what's called morning report. Morning report is basically when all the residents come together, and in the presence of the attending, the residents will go through a few interesting cases that is worth sharing with everyone. So after morning report, it's going to be about 9 o'clock now in the morning. Everyone goes back to the hospital floor. The residents and the attending will lead the charge in deciding what the plan is for each patient. Depending on how many patients there are, rounds can last all the way up to noon. Now at noon, the residents usually go to a lecture. Now lecture lasts 1 hour, so at 1 p.m. everyone goes back to the hospital floors, and from 1 p.m. to 3 p.m. is basically the time that the residents get to really carry out the plans that they decided on with their attendings earlier in the morning, and also see patients who are newly admitted from the emergency room. At 3:30, day residents then sign out to the residents who will be taking over in the afternoon and evening. So that is a summary of what an internal medicine resident's schedule might look like. So the general surgery resident will arrive at the hospital around 5:30 a.m. At that time, they will check and review the list of patients they have, similar to what the internal medicine resident does as well. At 6 o'clock a.m., they will round with their chief resident. After rounding with their chief, it will usually be around 7 o'clock, and at 7 o'clock, all the residents go to the conference. After the lecture, it will be about 9 a.m. in the morning. At that point, the resident will go to the pre-op area. Will find the patient that they will be performing the surgery on. At about 9:30 or so, the resident will be with the attending, who at that point is also prepping to perform the surgery. Now, the length of the surgery depends on what kind of surgery is being performed. It can range from a few hours to many hours. Based on when the surgery ends, scrub out and then take a lunch break. But usually those breaks are quite short, maybe 20-30 minutes. After the resident finishes his or her last surgery, it usually is around 4 or 5 p.m. in the evening. At that point, they go back to the hospital floors and then they recheck the patients that they saw in the morning. So that's basically the schedule of a general surgery residence day. This is just covering a routine schedule of a resident and doesn't include schedules residents have when they are on call. So those schedules are quite different and usually are much longer than. In internal medicine, the skills that are more emphasized is your diagnostic skills. Most of the time when a patient first is admitted to the hospital, it's up to the internal medicine doctor to really get a comprehensive understanding of what is causing illness that the patient has. Second, the internal medicine resident focuses on how to treat the patients medically. So their knowledge will emphasize on the physiology and really hone in on non-surgical treatments and be used as first line. For a general surgery resident, although diagnosis is still an important tool, it is not necessarily emphasized. When the patient sees a surgeon, at that point, they already have a diagnosis. And what the surgeon's job is to do is usually to manipulate a part of their body or take out something that shouldn't be there. A lot of the skill that is emphasized for a general surgery resident has to do with more hands-on manual dexterity. Another skill that a general surgery resident should hone is how to be able to take control of the situation if an emergency arises. Under those circumstances, the surgeon needs to stay calm, be able to think through the steps under a time-sensitive setting, and to be able to delegate tasks and move through an emergency in a step-by-step fashion. The last thing I wanted to touch upon, kind of highlighting the procedures versus surgeries. Now, there are a lot of people who would like to generalize and say that internal medicine residents don't do anything and all they do is just think, whereas general surgery residents don't think and all they do is do. I mean, of course, it's a generality. So in internal medicine, it can get quite hands-on at times. Procedures that you do include lumbar puncture, a paracentesis, replacing an arterial line, where dexterity and precision is also key factors. For internal medicine residents, the procedures they do usually last 15 to 30 minutes in the hospital bed. Now, for a general surgery resident, those surgeries they perform usually lasts from 30 minutes to 12 hours done in the operating room. And most of their surgeries do require general anesthesia. The main difference is duration and also the setting. So I would say that those are the main differences between the hands-on portion between internal medicine and general surgery. So after going through all the differences, I wanted to emphasize that there are similarities between the two. After all, both internal medicine residents and general surgery residents do take care of human beings, and sometimes they take care of the same human being. Both fields need to have a strong background in medical knowledge in both physiology and anatomy. And I don't want you guys to think that, internal medicine doctors only need to know physiology, whereas general surgeons only need to know anatomy. No, that's not true. In order to take care of the human being to the best extent, both specialties need to have a firm grasp of physiology and anatomy. Different areas of focus are available after completing residency in either specialty. There are so many subspecialties that you can go into after internal medicine or general surgery that it's impossible to list every single one of them here. But here I've compiled a few that can give you a taste of what is available after completion of each residency. You can see that after internal medicine, you can subspecialize in cardiovascular. And you also see that after completing general surgery, you can also subspecialize in cardiovascular. So what is the difference? Well, the difference is that the cardiologist specializes in how medicine can prevent damage to the heart or control your blood pressure, whereas the cardiovascular surgeon specializes in replacing the heart valve if the patient needed a heart valve repaired. In the end, the doctor, no matter if you are in internal medicine or general surgery, needs a solid foundation in all aspects of medicine to really give the patient the best care he or she deserves. As you can see, medicine is such a diverse space. It really is a field for all kinds of people who have different sorts of talents and interests. I hope you enjoyed this video, and I hope it did give you some clarity in the differences between internal medicine and general surgery, but also gave you an understanding of what the similarities are. If you found this video helpful, please give it a thumbs up, and don't forget to subscribe to this channel for more videos coming up about medicine. Don't forget to turn on the notification bell to get updates. Thank you so much for spending your day with me, and I'll see you next time. And also don't forget, if you'd like to know 5 things that people don't tell you before getting into medicine, make sure to click on the video above here and check that video out. Bye!